Dr. Thabane Poonyane, a practicing gynecologist in the Vaal area, to be specific, Vereeniging Mediclinic. I've been there for the last 9 years. So today I'll be responding to most of your concerns, questions that you might not have answers to. So I'm hoping this will be an informative session for you. I did my undergraduate studies at Vaal University. I then worked at Thabane Hospital for my internship community service. I then proceeded to do my registered time, which is post undergraduate studies at Vaal University again, specifically around the hospital that I rotated through was Baragwanath, Johannesburg Hospital, which is now Charlotte Maxeke, and Haima Musa. I then obtained a fellowship in ONG and a master's in ONG in 2015, and ever since I've been working as a gynecologist in private and public hospitals equally. For public work, I work at Thabane Hospital as an HOD in the Department of ONG, and part-time I do my part-time at Vereeniging Mediclinic. My experience is vast in both obstetrics and gynecology, and my areas of interest are laparoscopic work, but at the moment my specialty that I'm pursuing is maternal and fetal medicine. For me to pursue this career in ONG, it came as a result of my mother's experience. She told me that she shared with me actually she had multiple miscarriages before I was conceived. As a result, she had what we call today cardiac failure as a result of a pregnancy from which I was born. So I felt it deemed that I should pursue a career in gynecology and obstetrics so that I can contribute to helping and saving lives of women like my mother, and offer overall improving women's health. So for me to keep updated in the field of gynecology, it is very important that we do what is called continuous medical education. We have to be updated because things change every day. There's evidence that keeps coming up every day. So as a gynecologist in practice, both academics and in private, one has to be updated so that we give the patients the best updated care, current, and that is well accepted, and that is gold standard as well. So one has to read every day, attend congresses, engage in teaching, participate in internship training, and also that's to keep you to read and participate at all levels where you can improve women's health. At the core of patient care is respect for patients, giving patients autonomy, not being judgmental, giving the patient the opportunity to express their concerns, be heard, address every issue that they have with their conditions, being open to them on what you are capable of doing and offering to them, and not concealing anything from the patient. That is very important. It helps with establishing good rapport. It helps with establishing good patient relationships. And also it minimizes a lot of things like litigation, because you are being honest to the patient and you are affording them time to be heard. In my field of practice, we come across a lot of challenges. One of the biggest challenges is having to deal with a child who, for instance, has fallen pregnant and the parents don't know. And the child comes and confides in you and wants or requests a termination of pregnancy. In such cases, one has to be cautious that parents are the ones who are paying for this child's Medicaid, for instance, and the child cannot have the autonomy to decide at some point. So there's a lot of ethical issues involved that one needs to consider. However, one has to also respect the patient's choice and the trust that they entrust you with. So those are some of the cases that we encounter that are quite challenging and intricate in the field, but they need to be dealt with very, very sensitively. In my practice, it's a very busy practice. Confidentiality is at the core of patient care. by being aware that patients come there with the trust that whatever they're going to tell me or share with me is safe in my space. I have to make sure that when they come in, their names are concealed, their files are protected, my staff does not have access to their files or the information thereof that is embedded inside. And in the rooms are semi-soundproof. We don't make noise. We keep things privately. Their results are kept privately. We always try and get consent for whatever investigations we want to encounter or to do. Even before I examine them, I make sure that I respect them. They give me access to their privacy. I cannot just invade their privacy without them giving me consent. So that is also part of their confidentiality. I need to maintain it at all times that they are safe with me. By far the most common condition that we encounter is pregnancy. And pregnancy with itself brings along happy times and bad times. We're always happy to see a smooth pregnancy that doesn't have any complications. Very often we have complications in pregnancy. Secondly, we have gynecological issues. Menstrual issues are a problem. Bleeding issues are a problem. Miscarriages are a problem. Chronic pelvic pain, including things like fibroids. There's a lot of infertility happening around that we encounter, for which we refer out to our colleagues who deal with infertility issues. But chronic pelvic pain and menstrual or abnormal uterine bleeding issues are one of the most common gynecological issues we come across. For our patients, we always encourage annual checkups. At our annual checkups, we must make sure that we get appropriate history from the patient. That history will guide us on how to then guide the patient on what to do going forth with their lives. Things that are preventable, things like hypertension, they can either be preventable or managed: diabetes, obesity, smoking, alcohol consumption, exercise. Such things are preventative measures that we can undertake to prevent adverse events in pregnancy and in gynecology in general. So we always try and encourage our patients to come and see us at least on an annual basis to do things like a pap smear, which has been proven to decrease or minimize the incidence of cancer of the cervix. Things like doing mammograms, for instance, in our ladies who are elderly, to protect them or to screen for breast cancer for that matter. So those are kind of preventative measures that we undertake to protect our women from having any adverse events. So one of the most important things when one deals with examining patients, it's always getting consent from the patient to examine them first. For gynecologists in general, we always encourage that one should have what we call a chaperone, or somebody as an accompaniment that will be with you in a room when you examine a woman. Very often our women are uncomfortable because they have to expose themselves. For us as a maid, for instance, they might not be comfortable. So in my practice, I have a chaperone, a lady who is with me, who joins me when I examine patients. That provides a level of comfort, security, safety for that matter for the patient, and also minimizes anxiety and pain during examination when I see my patients. In our field of work, we have a term called multidisciplinary teams, in which we engage with other team players. For instance, if a woman has got cancer of the cervix, she will present with bleeding, she will present with pain, she will present with bladder or kidney issues. In such scenarios, we normally will engage with urologists, pain physicians, physiotherapists, hematologists, where feasible, to try and optimize this patient's health. So a multidisciplinary team always helps manage this patient, including psychologists, social work, involving the family, counseling. So use of other teams to try and manage the patient also help mentally, psychologically, and emotionally in healing of these patients. Well, in my line of work, my practice is diverse. I have a lot of patients, both of all colors, all ethnicities. So what I try and do is I try and communicate with my patients in the language they best understand. Where feasible, I speak in native languages. Where I don't understand a language, for instance, if I have a patient from India or from anywhere in Africa, it will be a challenge for me. But however, I try to bridge that gap where feasible, to try and be as cognizant of a patient's background, their ethnic background for that matter, and their cultural beliefs, respect them, and also consider alternative medicine and therapy for them where feasible. Currently, my interest is in maternal and fetal medicine, and that's where I consider myself going forth, because I'm more interested in diagnosing problems in kids before they are born, minimizing risks to mothers, things like hypertension, diabetes, managing medical conditions. That's my field of interest, in trying to improve maternal health in general. In situations where a patient is anxious, uncomfortable, scared, afraid, I always try and calm them down. I always try and get them with their partners family members who can help them understand, comprehend better. Because in situations where a patient is anxious, they will not listen, or they will not be able to hear the message you're trying to get across. So in situations like that, always try and provide an environment that is conducive, calm, safe, secure for the patient, and have somebody there who can reassure the patient, including a family member who can then help with reiterating the information to the patient that we explained. Technology is very important going forth, as we can see now currently with things like apps for that matter. Apps can be very important for a practice where patients can be able to download an app that belongs to your practice. And on that app, for instance, you can be able to download information that is necessary for the patient to read, to also refer and ask you questions, information that can be helpful pertaining to procedures you're going to offer patients and how you're going to measure going forth. So that is almost like information sharing with patients at that platform where they can access it remotely, away from you. They can also empower themselves before they come to you. So that's where technology can play a role. There are many trials ongoing currently throughout the whole world in obstetrics and gynecology pertaining to patient safety, optimizing women's health, child health. Of interest currently is what we call now genetic studies. We're trying to see if we can diagnose problems before there is even fertilization. So in a field like infertility, they are now able to diagnose embryos that might have issues with genetic conditions that can be inherited. So they are able to then guide or advise parents to then decide on which embryos to implant or which embryos can be selected for the implantation. So that's a field that is very interesting, that is evolving, but there's still a lot to be seen, and that is upcoming. In few years we'll see how things evolve and change our practice. Very often we see patients with menopause, sexual dysfunction. So such patients want to be sensitive when you talk to them. Very often, again, like I mentioned, we have to involve their partners so that they also gain understanding of what their partners are going through. Because if you try and explain to the patient alone, and in the absence of their partners, they will not be able to convey the message as you explain to them, to their partners. It's very important that you discuss medication that you're going to use, their benefits, side effects, and then alternatively you can offer them as well. So one must be sensitive when such issues, bearing in mind that there's also cultural issues that ought to be considered when guiding advising these patients. In 2017, there's a lady once delivered. She had severe hypertension in pregnancy, what we call preeclampsia. She was only 26 weeks when she delivered. Her baby today is 8 years and alive, happy. One ought to be very open, and again, like I've mentioned, one has to be open to using multidisciplinary care, the use of social worker, psychologists, psychiatrists, refer appropriately patients where they can get more help. So one has to be very open with the patients and make every opportunity available to them that they can decide the point of care that is most feasible for them to improve their emotional and psychological health. Complementary medicine is very important, especially in our African population, where our society still believes in using our traditional healers. One ought not to criticize or ostracize such practices, but complement our care with them, bearing in mind that there is medication that is being used, so it must not interact with the medicine that we render to our patients. It will most often be important to have a communication with the healers that are involved and make them part of the team so that we can talk the same language for the betterment of the patient. For instance, in a patient who's Jehovah's Witness, for that matter, where they don't take blood from other people for that matter, one ought to respect them, and they will tell you that, doctor, listen, in an event that where I'm terminal and my life is in danger, do not give me any blood under any circumstance. One has to respect that choice, because that choice was wrong before. So it's a choice that the patient makes, and one has to respect it.